Welcome back to the Whiteboard Series. I'm Dr. J. Michael Bennett. I'm a Board Certified Orthopedic Surgeon specializing in sports medicine and minimally invasive surgery of the shoulder, elbow, and knee. Today we're talking about popping joints, specifically we're talking about the elbow, painful popping in the elbow or a painful pop in the elbow. So what do? If you particularly found yourself in a position where you were lifting something heavy and you felt a loud pop in your elbow, or it almost felt like somebody slapped your arm, and then you notice significant bruising and swelling in the elbow. Well, what could that be? What could that mean? Well, first off, let's go over some of the basic elbow anatomy. This is an elbow joint here. This is the humerus that you're seeing right here. This is the radial head, and then the ulna. So there's three bones that articulate that create the elbow joint that allows you to flex and extend, as well as what we call pronation and supination, which is palm down and palm up. The ligaments that stabilize the elbow are the ulnar collateral ligament on the medial side or the inside of the elbow, the lateral collateral ligament, which is the outside of the elbow, and as far as other tendons and important tendons around the elbow joint, there's the biceps, the distal biceps, which asserts on the radial tuberosity right here, that allows you to give you strength with supination or twisting, as well as with flexion. And that's where the biceps comes down and inserts right there. So, going back to the scenario we just discussed, what happens if you lifted something or caught something and felt a painful popping in your elbow, you notice a lot of bruising and swelling afterwards, what do? Well, the first thing you want to think about as a possibility is your biceps tendon. And that biceps tendon comes down and inserts right on that radial tuberosity. And when it does pop, it will disrupt right at the base where it inserts, and it retracts. Okay? And depending on how much degeneration you have at the distal biceps, or how strong of a force it was that you caught something that was falling, depends on how far it's going to retract upward. There have been some patients that have maybe a partial tear of the distal biceps. Sometimes you can have a full thickness rupture where it retracts all the way up past the joint line, where it's significantly retracted. Because all muscles retract like a rubber band when you take it and it snaps back. So the muscles are going to do the same thing. The thing about the biceps is that if you do have a distal rupture, it's serious, and you want to get it looked at immediately, especially if you're active or you depend on a laborious activity, or your livelihood is a laborious activity, or your work, your typical work is with your hands. Typically you want us to be evaluated by a specialist, because if it is a significant tear and you depend on your hands for a living, it might be something you want to consider to have fixed. So the way we fix this, we actually bring this biceps tendon back down to the bone and repair it down to the bone. If you do not fix it and it continues to retract upward, you can lose significant amount of strength with rotating and with flexion. So just keep that in mind and get it evaluated.